I think it just keeps you young, it keeps you fresh, it keeps you energetic. It helps put things into perspective because this is the next generation that's going to carry the torch. I learn a lot, actually, from students, not just from Bryan, from all students, but I think it keeps me on my toes, right? Because med students are curious, they're asking questions, they want to know why things work. Same thing with residents. And I gotta have the answers. And if I don't have the answers, I gotta help them figure out how to find them and let me know what the answer is. But I think it just keeps you young, it keeps you fresh, it keeps you energetic. It helps put things into perspective because this is the next generation that's gonna carry the torch.
Yeah.
And I didn't get where I am by myself. You know, I got help, I got guidance, and if I can sort of reach back and give even a small amount of what was given to me, I feel like I've at least honored the legacy of the folks that helped me get where I am today.
Yeah, and you've been passing on that like thirst to serve the community. We've done some great work in the community together, you know, facilitating STEM education for high school students. And as I think about like the type of career I want to have, the type of professional I want to be, I've admired you for that. Like you carve out intentional time to be there for folks who are interested in medicine and for folks who just want to have a conversation with you. That's something I appreciate.
I'd say that my interaction with MD PhD students is by happenstance. And that I probably have an honorary PhD that wasn't earned. But if you go back to my medical school days, I was mentored by Ed Vates, who's an MD PhD. I took time out to do research and ended up getting a master's in neurobiology and anatomy and passed the qualifying exams for PhD, but my wife said you're only allowed one go. So I quickly matriculated back into medical school. But it was through those relationships that I built sort of long-lasting interest and love for research and all of the infrastructure and the mentoring and the community that was involved in that. And so the one of the first students that I had the privilege of mentoring grew out of those relationships. Her name was Emma Strouderman, and she's currently still in the PhD program. And then based upon just the fact that, you know, I'm still doing some research, I think students tend to, if they're not at least working with me, they tend to at least, you know, reach out and ask me questions. How do I navigate this? Who are people I should be talking to? How do I set up rotations? And a few people have started doing some research with me. Yeah. And so I think that having gone to this institution and having developed those relationships, I think it's opened the door for me to be able to interact with those students. And I would say that MD PhD students here have just a different level of curiosity, and they dig deeper, I think, than the average medical student when it comes to trying to understand what is going on, not just with the nervous system, but you know, with medicine in general.
Yeah, it's a pervasive itch almost when you apply the research lens in a clinical setting. I think the PhD has made me want to know. It's made me want to be around folks who are curious. It's made me a solution seeker. I think the PhD has made me think more about policy and the way we do things in medicine and whether or not there's a way we can do things better. I really like translational sciences, and I think transitioning back into medical school has helped me see the impact of research. Like, you know, how has research informed how we take care of people and their outcomes? And what can research do to help us improve their outcomes? Yeah. And, you know, you and I both share a passion for community service and community work. And, you know, Rochester, honestly, is like a laboratory for the impact of history, of structural racism. You know, you look at folks' zip codes and it can tell you about their health, their education, their life expectancy. Yeah. and you know, health, especially here in Rochester, is a key part of people's well-being. It's like health, University of Rochester, it is the thing in Rochester.
Yeah.
So I think like the PhD is kind of challenged me, kind of charged me with the responsibility of thinking about how do I make healthcare better.
Yeah.
It's made me feel obligated to step into clinical settings with that framework and that lens for like what's next. And I feel like I'm always thinking about like, what's the next thing?
Yeah.